Hello, I'm Dr. Dominick Maino, and we're here today at Lions Family Eye Care to discuss a very important issue. And that issue is of the binocular vision pandemic, meaning that there are vision problems out there that affect a child's life in an adverse way. Their quality of life suffers because they suffer from headaches, blurred vision, double vision. They can't read. They can't study. Sports is something that is just beyond them, just because of this hidden visual problem. Some time ago, I wrote a paper for the Optometry and Vision Development Journal, which I was the editor, entitled The Binocular Vision Dysfunction Pandemic. Now, pandemic means close to being an epidemic. If I rewrote this paper today, I would indeed call it an epidemic. And let me read a paragraph from this paper. In comparison to glaucoma, cataract, age-related macular degeneration, diabetic retinopathy, and dry eye syndrome, binocular vision disorders are more frequently encountered than these diseases and have significant negative effects on one's quality of life. One study revealed that the prevalence of accommodative or focusing disorders and binocular vision disorders is 9.7 times greater than the prevalence of ocular disease in children ages 6 months to 5 years of age. It is 8.5 times greater than the prevalence of ocular disease in children ages 6 to 18 years of age. Another study of about 1,700 patients between the ages of 18 and 38 showed that 56% presented with symptoms associated with binocular vision dysfunction. Although these are alarming statistics, a disconnect exists between the high prevalence of binocular vision disorders in the general population and the binocular vision patients reported being evaluated within the healthcare field. Can you imagine that? Not that ocular disease is not important, it is. But why are we consistently missing all of these significant vision problems that so adversely affect our children? As a professor of pediatrics and binocular vision at the Illinois College of Optometry and Illinois Eye Institute, I teach our students how to diagnose and treat these significant problems. So the ability to both diagnose and treat these problems is there. Our doctors know how to diagnose and treat these problems. The issue is getting these children to the professionals who can help them. One way to do that, of course, is if they can't immediately have accessibility to a comprehensive eye and vision exam, is to include in our efforts, in any kind of screening, some system that appropriately evaluates the presence of these issues and of these problems, so that appropriate diagnoses can get started and these children can be pointed in the right direction so that they can be evaluated and treated. One of the things we noticed while researching this paper and while I work with patients is that many individuals are not aware that these problems exist. And they are of many different kinds. One is called convergence insufficiency, which is the most frequently encountered binocular vision problem currently. And up to about 6% of the population may indeed have this disorder. Then there's convergence excess, where the eyes want to turn in too much. You can have also eye movement problems. And if you have eye movement problems, there have been children I've seen where they skip words, they skip sentences, they skip full paragraphs, and they don't even know they've done it. And of course, within that as well is any focusing issues. Focusing allows us to maintain clarity of vision no matter at what distance we are looking. So the diagnosis and treatment of these binocular vision problems so that our children can have single, clear, two-eyed, comfortable vision is extremely important. Not only do we need to make sure any vision screening that we elect to provide for our children, any vision screening must have a section that evaluates the presence of these binocular vision disorders. But it is also important to note the difference between a vision screening and a comprehensive eye and vision exam. Vision screenings do not replace a full eye exam. Every single child deserves a full eye exam. It is important that a healthcare professional, an optometrist, evaluates the vision, evaluates the binocular vision problems, evaluates the eye health for our children so that they can perform at the highest level academically, in sports, and in every endeavor they wish to do. In today's society, and especially if you have children, you know this, they are constantly looking at screens, televisions, computers, tablets, iPads, iPhones. The amount of visual stress our children encounter today is enormous, and there are some children who will maladapt, who will suffer problems because of this. So one, yes, have a vision screening that can detect these binocular vision dysfunctions. But always, always know that the best place to ensure the welfare of your child is by scheduling them every single year for a full comprehensive eye exam, typically with someone who has some expertise in the area of pediatrics and binocular vision. There are numerous sources where you can obtain additional information and even referrals to the kinds of doctors you should probably seek out. Certainly, if you have a school or college of optometry in your state, please call the Pediatric Binocular Vision Department and they will point you in the right direction. If you do not, there are several organizations that you should call as well, including your State Optometric Association, the College of Optometrists in Vision Development, or covd.org, the Optometric Extension Program. The other issue we're facing more and more with our children these days, especially those who participate in any number of different sports, is concussion, is traumatic brain injury. Oftentimes, we take our kids, we tell them shake it off, and we put them back in the game. A study was recently published that showed girls are put back into the game after a concussion much quicker than boys. If a concussion is there, all of these binocular vision problems that I discussed are there. So problems with convergence and divergence, with eye movement and focusing after a concussion is always made worse or appear. So we want appropriate screening devices. We want our children to have full, comprehensive eye and vision examinations by optometrists who specialize perhaps in this area. And for sure, if any of your children are involved in sports, they should also be assessed if there's a suspicion of a concussion. A concussion is a traumatic brain injury.
Excellent. I'm going to keep on rolling. I want to backtrack a little bit. You mentioned things about visual stress and the amount of time we spend on near vision devices. Just as, I guess, throwing it out there, is there an age where that kind of stress should be limited, and maybe as they get older they could use those kind of devices more? What are some guidelines around those kinds of things?
Ooh, I'm glad you asked.
Yeah.
Children who are using these devices, these computers, the iPhones, the iPads, they use it extensively, nonstop, every minute of the day. You're in the car, you're driving. Your kids are on the iPhone. You're at home, it's dinner time. Your kids have their iPad. In school, they have computers. At home, they are never without an electronic device in their hand or nearby. I had mentioned that interacting with these devices can cause significant problems when it comes to the binocular vision system. So the American Optometric Association recommends under age of 2, no devices. I'm going to do that one again. If your child is under the age of 2, they do not need an iPad or an iPhone. They need to be playing. They need to be exploring their world with their eyes, with their hands, with touch, with feelings. They need to be outside, running around. They need to be children. After age 2, and as they enter into school, the American Optometric Association says no more than 2 hours total screen time. Now that may seem a lot, but if you put into that the mix of being in school where they have the computers, the tablets, and all those other electronic devices they use, and then when they come in, they do homework on the computer at home, they watch the television, they go straight to their iPads and iPhones and tablets. It is very easy to eat up 2 hours of time, but you should limit children's access to these devices. And finally, the American Optometric Association recommends that 1 hour before bedtime, no electronic devices whatsoever. No iPads, no iPhones in the bedroom. These screens emit something called blue light. Blue light has been shown to disrupt the sleep cycle. We want our children to be well rested so they're ready for the next day. So, in summary, no more than 2 hours for grade school children, and no screen time at all 1 hour before bed. Have them pick up a book, have them read, then go to sleep.
Mm-hmm.
And it was put together by a pediatrician because her own family were dealing with these issues. And her kids, the phone right here, the iPad right here. And she did a little research and discovered really it's a significant problem. Both in terms of expectations for the child, like the child has to be entertained every single second. I don't know about you, but me when I was growing up, being bored, I didn't like it, but it was a good thing because I became inventive.
Creative.
My buddies and I, we went out, we put together like a basketball game or football game, or we made up a game. We went out riding our bike. It was summertime, we were bored, but we figured out what to do. We became creative. Now, you get 10 kids in a room, 10 kids have this. They're all sitting looking at the screens, they're not talking, communicating, nothing.
I want to get down to the nuts and bolts of the stress.
Okay.
Color, movement, the nearness of the screen itself. Now, I can understand like all that activity, all that complexity is stressful on the eyes. What kind of things can people do that aren't as stressful on the eyes? I hate to throw one out there just out of a question, but is that just like watching trees or something? Or,
in fact, that's not a bad idea.
yeah. or bird watching or something,
Yeah,
right?
yeah. Are we rolling?
We're rolling,
Okay.
yeah.
It is highly recommended, and there's studies to show, for instance, the more time children spend outside, playing, interacting with their environment, the less nearsighted they become. So, whatever that association may be, the take-home here is, let your kid go outside. Let them be a child in a way that is reminiscent of when I was a kid, and maybe perhaps when you were a child, because that's how we learn to interact with our world, how we learn to interact with our friends, and how we learned to deal with boredom and frustration in a constructive and appropriate way. Other ways of dealing with this kind of visual stress induced by all these screens, there's something known as computer vision syndrome. And computer vision syndrome, both children and adults, and especially those who might work in an environment where they're dealing with computers day in and day out, also has, as part of its diagnostic factor, all these things we mentioned about binocular vision dysfunction. One of the things the American Optometric Association strongly recommends we follow is the 20/20 rule. For older kids, for teens and adults, you're working on that computer, you're working on that tablet, you're using your iPhone, at least every 20 minutes you look up and away for 20 seconds. Give your system an opportunity to recalibrate, to adjust, to rest if you will, and then go back to whatever you're doing up close. 20/20 rule. 20 minutes working, 20 seconds resting if you will. And if you do that, you can often avoid any prolonged dysfunction, symptoms, or signs of the binocular vision dysfunction. And you become more productive and certainly more comfortable throughout your day.